Let us start with something honest. If you have ever laughed too hard and suddenly thought, wait, what just happened? If you have ever sneezed and quietly crossed your legs like your life depended on it, or if you have ever wondered why your body does not feel the same after childbirth, you are not alone. And no, your body is not broken. These experiences are far more common than most women are willing to admit, and they do not mean you have failed in any way. They simply mean your body is communicating with you. Today, we are talking about Kegel exercises for women, but more importantly, we are talking about how to identify your pelvic floor muscles correctly. This is where most women get it wrong, and unfortunately, this is also why many women say Kegels do not work. Trust me when I say this, squeezing your stomach, clenching your buttocks like you are holding 1 million naira between your cheeks, or holding your breath like you are underwater, is not a Kegel. Yes, it needed to be said. Kegel exercises are often misunderstood because they are invisible. There is no dramatic movement, no sweating, no mirror feedback, and no obvious sign that you are doing anything at all. Because of this, many women substitute the real work with nearby muscles and assume they are doing the right thing. Over time, this leads to frustration, wasted effort, and the belief that something is wrong with their bodies. The truth is much simpler. The muscles just have not been identified properly. What exactly are Kegel exercises in simple terms? Kegel exercises are tiny, controlled muscle contractions that strengthen your pelvic floor muscles. These muscles sit deep inside your pelvis and act like a supportive hammock. They support your bladder, support your uterus, support your bowels, help control urine, contribute to post-childbirth recovery, and play a significant role in sexual pleasure and responsiveness. When these muscles are strong and coordinated, everyday activities like laughing, coughing, lifting, and intimacy feel more secure and comfortable. When they are weak or poorly controlled, leakage, heaviness, reduced sensation, and discomfort can occur. Here is the catch that most people miss. If you do not know the right muscles, you cannot train them. That is like going to the gym to train your legs, but doing arm workouts instead, and then wondering why your thighs are not changing. Effort without accuracy does not produce results. Before learning how to do Kegels, it is important to understand the signs that you may already be doing them incorrectly. Many women unknowingly fall into this category. You are likely doing Kegels wrongly if your inner thighs are squeezing hard, your buttocks are clenching, your stomach is pulling in strongly, your face is tightening like you are angry at life, or you are holding your breath as if someone told you not to breathe. If any of these are happening, the best thing to do is pause, reset, and relax. A proper Kegel is quiet, gentle, and internal. Nobody in the room should know you are doing it. One of the beautiful things about proper Kegels is that they can be done almost anywhere. You can do them while sitting, lying down, standing, watching television, driving, or standing in the kitchen. There are no dramatic movements required. If it looks like an exercise from the outside, something is off. Now let us move into the most important part: how to identify your pelvic floor muscles the right way. The first method is the stop the flow test. This is the most commonly mentioned method, but it must be used carefully. Next time you go to urinate, start normally, then gently try to stop the flow midstream. The muscles you use to stop the urine are your pelvic floor muscles. This method is only for identification. It is not meant to be practiced regularly. Making a habit of stopping urine can strain the bladder and increase the risk of urinary issues. The second method is the tampon squeeze method for women who use tampons. When a tampon is inserted, gently try to squeeze inward as if you are trying to lift or hold the tampon inside. The muscles that tighten during that internal squeeze are your pelvic floor muscles. Not your thighs, not your buttocks, and not your stomach. Just an internal tightening sensation. The third method is the finger feel test, which provides direct feedback. Wash your hands thoroughly, insert 1 or 2 clean fingers into your vagina, and gently try to squeeze inward. You should feel a soft tightening and a gentle closing around your fingers. It should not be painful or forceful. It should feel controlled and subtle. If you feel nothing at first, do not panic. These muscles are shy. They have often been ignored for years and need time to wake up. Before starting any Kegel practice, there is one important rule that should never be ignored. Always perform Kegels with an empty bladder. This means you should not hold urine while exercising and should not practice while feeling the urge to pee. Doing Kegels with a full bladder can strain the bladder, increase urinary problems, and teach the muscles unhealthy habits. Empty bladder first, always. Once the muscles are identified correctly, you can begin training them gently. One option is the hold method. You squeeze your pelvic floor muscles, hold for 5 to 10 seconds, relax for 5 to 10 seconds, breathe freely, and repeat 10 times. Another option is the quick squeeze method, where you squeeze and release immediately, repeating 10 to 15 times. These exercises can be done 3 to 4 times daily, morning, afternoon, and night. No special position is required. It is important to understand that pelvic floor training is not about force. It is about control. Pelvic floor muscles are small, deep, endurance muscles. They do not respond well to aggression. Starting gently allows them to learn and strengthen gradually. Just as you would not lift heavy weights on your first day at the gym, you do not need to overdo this. Consistency is far more effective than force. Many women feel embarrassed talking about pelvic floor health. Some believe it is only for older women. Others think it is only necessary after childbirth. That is simply not true. Kegels are for young women, single women, married women, postpartum women, women preparing for childbirth, women who want better body awareness, women who want better intimacy, and women who want confidence in their bodies. In short, Kegels are for all women. Now, let us go deeper into common mistakes, realistic results, timelines, intimacy, pregnancy, and safety. This is where many women either give up too soon, practice incorrectly, or expect overnight miracles. Clearing these misunderstandings can make all the difference. One of the most common mistakes is oversqueezing. Some women squeeze with extreme effort, face tight, jaw clenched, breath held. Pelvic floor muscles do not thrive under aggression. When you squeeze too hard, the muscles fatigue quickly, blood flow is reduced, and tension replaces strength. Gentle, controlled contractions are far more effective. Think lift and hold, not crush and clamp. Another frequent mistake is holding the breath. The moment you hold your breath, abdominal pressure increases and the pelvic floor is pushed downward instead of lifting. This works against the goal. Breathing freely is essential. If you cannot breathe comfortably while doing a Kegel, the squeeze is too strong. 2. Using the wrong muscles is another issue that cannot be overstated. The thighs, buttocks and stomach should remain relaxed. Proper Kegels are internal, subtle, and quiet. If someone can see you doing them, something is wrong. Inconsistency is another major barrier to results. Doing Kegels only when you remember will not produce meaningful change. These muscles need daily activation and regular reminders. Think of it like brushing your teeth. Small daily effort produces long-term benefits. Many women ask how long it takes before results are noticeable. Honesty is important here. This is not magic. Most women experience better muscle awareness and connection within 2 to 3 weeks. Between 4 and 6 weeks, bladder control and endurance often improve. By 8 to 12 weeks, many women notice improved tightness, responsiveness, and confidence. Consistency matters more than speed. Stopping after 1 week and deciding it does not work is like planting maize today and checking tomorrow for harvest. Kegels and intimacy deserve respectful and clear discussion. Strong pelvic floor muscles increase blood flow to the vaginal area, improve sensation, enhance muscle control during intimacy, and can improve orgasm intensity for many women. They can also improve partner satisfaction. However, Kegels are not about force or artificial tightness. They are about responsiveness, coordination, and healthy muscle function. Kegels during pregnancy are generally safe and often recommended unless a healthcare provider advises otherwise. They can reduce urine leakage during pregnancy, support the growing uterus, improve pushing control during labor, and speed postpartum recovery. During pregnancy, contractions should remain gentle and long holds should be avoided if uncomfortable. Any pain or discomfort is a signal to stop and seek professional guidance. After childbirth, pelvic floor muscles are often weakened or overstretched. This is normal. The key is to start slowly with gentle squeezes, short holds, and adequate rest between contractions. Over time, strength and control return, but only with consistent and patient practice. It is also possible to overdo Kegels. This is rarely discussed, but very important. Overtraining can lead to pelvic tension, pain during intercourse, difficulty relaxing the muscles, and ongoing pelvic discomfort. Signs of overdoing it include pain instead of improvement, trouble relaxing after squeezing, and persistent discomfort. Balance is essential. Relaxation is just as important as contraction. Medical help should be sought if there is persistent pelvic pain, worsening urine leakage, pain during intercourse, or no improvement after several months of consistent practice. A pelvic floor physiotherapist can provide personalized assessment and guidance. Your pelvic floor is part of your body, not something to ignore or feel ashamed of. Training it is an act of self-care, body awareness, health maintenance, and confidence building. You do not need perfection or pressure. You need consistency and patience. Understanding your body is already a win. A strong pelvic floor supports not just physical health, but emotional confidence as well.